Great. So I think it's helpful to start with an understanding of homelessness. There's been a definition developed by a Métis scholar, Jesse Thistle, and he frames Indigenous homelessness specifically as existing across 12 dimensions. Homelessness is not just about not having a roof over your head. It's actually more about disconnection from community, from kin, from other family members, from animals, from culture, from the land. And he has been very generous, I think, in stating, it's not just Indigenous communities that can think about homelessness this way. Really, homelessness is a full experience of having to not just have, no home to go to, but it is often that lack of connection, and it's that lack of being engaged in a broader community. And so I often see people who are in housing crisis who don't end up in the shelter system. And that's often because they actually have resources outside of just housing that they're able to access. So just to give you some scope, in Ottawa, we have about 8,000 people per year experiencing homelessness, 1,900 to 2,000 every single night in our shelter system. In the last, since 2014, we've seen about a 35% increase in family homelessness. That's the fastest growing total population of homelessness in Ottawa. And that looks to be about 400 families at any given time. And then in one of our point in time counts in 2018, it was indicated that we had 24% of folks on the street who identified as First Nations, Inuit, and Métis. That is very likely an undercount. The Indigenous partners in our community have said that repeatedly. And nationally, it's minimally 30%. So we anticipate that there's a lot of folks who, for very good reason, don't feel comfortable identifying, may not be moving into or out of the shelter system, but actually trying to find other ways to get the support they need and may not be touching the system in the same way. I think what's really important to remember, women fleeing violence are actually not counted in those numbers. The system, the violence against women shelter system, is separate from the main homelessness number system. So we don't actually have a good understanding of the collective number of women who are in that situation. There's lots of crossover, which is the other piece, but we're not currently thinking about the numbers as a collective. We're sort of interpreting them as different systems, which is problematic because, the same people are using different systems all the time in different agencies. So one of the things I think to really highlight is there's many impacts because of COVID, but in particular, we are on the cliff of an evictions crisis. We called 2 years ago a housing and homelessness emergency in Ottawa. And now as COVID's come in, there are about 2,500 households in just Ottawa that are at risk of being evicted. And many are actually already getting evicted simply because of not being able to pay the rent, particularly because of income loss in that first sort of 6 months in lockdown where people were losing their income. We don't know what that's going to look like. Not every single one of those households is going to hit the shelter system, but it's significant. So I think it's really important to think about how we got here, and that actually the story of homelessness in Canada is a policy story and it is a system story. It is not about personal circumstances. And a lot of the time we like to think about this as a personal choice or a personal set of issues that led to somebody being on the street. And I think what's really important to remember is that homelessness is new. We did not have mass homelessness at the numbers that we do now, basically before the early 1980s. It just did not exist at this scale. You always saw people move in and out of homelessness a little bit, but the numbers were small. They were not chronic. People didn't get stuck in the shelter system. And it certainly wasn't as diverse as it is now. Now, one of the biggest homeless populations are families. So we have about 235,000 people experiencing homelessness in Canada every year. I would argue that that is a significant undercount that specifically deals with folks who are in shelters. There's a lot of other ways that people experience homelessness, whether they're sleeping rough. Women often will sleep on couches or have to exchange sex for housing. That's a common occurrence. And there's a lot of different ways that people have to navigate that experience of homelessness. I think a bit of history is actually really helpful here. So thinking about homelessness back in the 1930s, the concept didn't really exist. What it did sort of look at was more slum situations and poor housing quality. And then as we look to the post-war period, a number of key things happened. One, there was this desire to bulldoze slums and some of those poor housing condition areas. But in doing that, it was considered a positive thing. And a lot of those sort of large rental towers were starting to get built, or subdivisions were starting to replace what used to be slums. Again, people think that's a good thing, but I think there's some definite unintended consequences that happen with that. And what I think is fascinating is 1945, the mortgage was created. It did not exist before. So all of a sudden, home ownership was accessible. It was accessible to, average families, but people who actually were middle class. And that completely changed the game in the housing landscape. So all of a sudden you had a market develop of private developers, and this idea of single home ownership became, I think, very much a fixation. And I'm sure all of us are very well aware of what's happening right now in terms of the housing crisis. It's never been this escalated, and it has severe consequences for people being able to live and work in the cities that people have engaged in or grown up in. Then in the 1970s, the federal government was actually building about 20,000 nonprofit social housing units a year. At the height of the National Housing Strategy, which we're sort of moving into, I think, the first third, might even be the fifth year or fourth year at this point, we're only, I think, going to be building at over a 10-year period. I think it's not 100,000, I think it's 50,000 units. So 20,000 every single year compared to where we are when we're putting an increased emphasis on homelessness. And I do need to check that number, so please don't hold me to it, but it is significantly less. Then in 1993, after doing this significant increase of affordable housing or social housing being built, the federal government said, we're going to stop funding entirely. We are out of the housing game. We are going to put housing down to the provinces and to municipalities, the lesser resourced levels of government, and we're actually going to just step away from it. So what happened during that time is no housing, huge increase in homelessness. We literally created it within a decade. 2002, the federal government said, maybe that was a bad call. We actually need to get back into putting money into building affordable housing. And they have done that, but never close to the levels that were once there. So there you can kind of see at the height of where we were in 1972, it was over actually 30,000, almost 40,000 units, down to 2010, and you see just less than 3,000. So we've dug a giant hole, and even as we attempt to get out, it's not even a matter of kind of keeping level with the demand. We're so far in the hole, we're scraping ourselves out of that, plus the increased amount of people who are not just homeless, but housing insecure. So what this has led to, as people have seen this crisis begin and build on itself, is an emergency response system. Most of our resourcing is focused on that crisis. Very little resourcing is focused on prevention, and very little is focused on accommodation and supports. We are seeing more start to move towards prevention and actual affordable housing, but the bulk of our money around homelessness is trying to just stop people from dying, is trying to prevent people from, not having a warm place to stay. So it's resulted in, shelters where shelters do a lot more than just a bed and a meal. They do a lot more and are providing significant amount of services, but most of it in the sector of social services still is very focused on just trying to sort of pause crisis, right? Most people come into that system when they're at a point of housing crisis, and most systems and supports are more focused on that piece. As well, it's complex. It's so complex. If anyone here has tried to help a friend or had to navigate any kind of social service, whether it's a community agency or a set of community agencies, whether it's accessing the centralized waiting list for housing, whether it's trying to get mental health supports, these systems are all interconnected and they're not coordinated. And it's incredibly difficult for a person, especially a person in crisis, to be able to navigate their way to the right service that they need. As well, housing loss is incredibly expensive. And I think what that integrated part is, when people are homeless, they don't just end up on the street, they also end up in other provincial systems. Jail being one of the most common ones, shelter beds is about $2,000 a month. Hospital beds, or the number of people who have to stay in hospital on an alternative level of care bed because there simply is no affordable housing, is extremely high. That's $10,000 a month. These are old numbers. I suspect it's gone up. And in Briere, actually, at least a while ago, it was around 40% of people who were in alternative level of care beds, but were unable to be discharged because of housing challenges and being able to find that affordable housing. So when you compare that to a rent supplement, around $700 actually in the city of Ottawa at 611, or social housing, it's a huge difference. $700, $200 for social housing. There are significant savings to be made when we invest in the right thing. And I think in Ottawa, it's really important to look at the story of family homelessness. Right now, in terms of overflow, we have significant number of overflow motels. It's happened because I think, the city has worked really hard, but has just not had other choices. And as a result, we're paying $3,000 a month for one family to stay in a motel. It's $36,000 a year. And over the course of the year, when you multiply that by just 400, and I use that number because currently there are 400 families, over a full year, there's 1,100. But of those 400, it's 14.4 million. And if you looked at doing a rent supplement, that's $612, it would be 2.9 million a year. So today, if we had that housing stock and we wanted to rehouse every single family, we could do it for basically $3 million. And instead, in the course of this year, those 400 families, it'll be 14.4 million. So what causes homelessness? And this is why I point to the idea that, personal circumstances happen to people, but they have always happened to people. As long as we've been humans, we've had challenges with relationships, addictions, mental health challenges have always existed. What has not always existed is the policy story that has led to homelessness. So we look to structural factors and we look to systems failures as the driver of mass homelessness in Canada. So just to give you a bit of a sense of some of these structural pieces, let's say that you're 18 years old, you live in a group home, and you've been under the care of the child welfare system for the past 4 years. On the eve of your 18th birthday, you are told to pack your bags. You have nowhere to go. You end up at a homeless shelter for adults, even though you're younger than most. You can't qualify for affordable housing until you have stayed in the shelter for 6 months. A friend asks if you want to stay with them for a little while, but if you do, you will lose your priority on that list. What do you do? These are the sorts of challenges I've worked with youth. I've seen that exact story play out in terms of somebody being 18 on their birthday and actually losing their housing. And that's the system that we have. So you see both a discharge from child welfare directly into homelessness, and you also see a window of opportunity in advance of that 18th birthday where we could have made a change. We could have set up housing arrangements. My sister's a high school teacher and sees this sort of situation happen all the time. It's not for lack of the child welfare system trying to address this, and there's certainly more and more emphasis on trying to ensure and create that stable housing for folks. But it is a structural piece that I think demonstrates some of the challenges people deal with. So the good part. Communities are actually ending homelessness in Canada, not just in other places. And I think that's the piece that we need to be really cognizant of. There are local, provincial, and national models of actually reducing and ending homelessness. So some examples, and I always think it's important to point to Edmonton because they're about the same size as Ottawa. They're actually a little bit bigger. They have seen a 43% reduction in homelessness since 2008. So it's been a long time of work, but they have seen a significant reduction. I think that's the one that we really need to look at. What are they doing that actually we could learn from and borrow from? Waterloo has had significant success in reducing family homelessness. At the height of their family homelessness crisis, they had about the same per capita numbers that Ottawa does. And they now, as of today, I think they had like over 250, 280, somewhere in that number. As of this month, I was told that they have about 6 families currently in the shelter system who are actually on their way to finding permanent housing. They put all their emphasis on prevention and reoriented the system to try and focus on that first. And the Medicine Hat's kind of the most famous Canadian example. They in 2015 said that they had ended homelessness. And even since then, probably about a couple months ago, they had reached functional zero, which we'll chat about a little bit more. But basically the idea that the number of people coming into the system is less than the number of people leaving the system. So you're able to rehouse people, more people than who are becoming homeless. Because we always know folks may have a housing crisis. That's just going to happen. We're always going to need that emergency response. But can we ensure that our emergency response is short, brief, and time limited, and it doesn't happen again? And can we actually make sure we're able to get people into permanent, stable housing as quickly as they're coming in? So what is working? Lots of good things are working, but it pretty much boils down to prevention, focused coordination, and affordable housing. I'm sure none of this is a shock to people. Affordable housing is obviously kind of the key thing here. But the other piece is actually, I find really encouraging, because a lot of these communities have not had the capital dollars to just build boatloads of affordable housing. In some ways they have, but it's more been focused on this big initial piece of prevention focused coordination and orienting the system in a different direction. Does anyone have a question? Sorry.
I'm not sure where that's coming from, Katie.
Okay. Okay. I'll keep going, and feel free to use the chat as well if people want to ask questions. Go right ahead. So basically the concept of, coordination, it's not rocket science for any of us, but every door is the right door, right? We have a myriad of services and programs and supports. No matter where you go, people should be functioning off of the same script across a collective system. So whether you go to, a youth program or whether you go to an adult program for veterans, the person who's doing your intake is going to ask you the same questions that everybody asks you, but it's entered into a central spot, so they don't have to re-ask you those questions. And they're going to also have a roadmap of how to get the right person to the right support. So that is one big thing that's been happening across the country. And, it's a lot of work to coordinate a system, no question. But you have to start somewhere, and you kind of piecemeal the sector out. Often people start with shelters, then they move to kind of day programs or other supports, and then start to look at those other kind of agencies that need to be brought into that. The other thing is you need multiple access points, right? When I worked with you, they were like, I need to text. I'm too anxious to call. I don't actually want to go physically maybe to a shelter because I might be intimidated or it may not be comfortable. And I need to be able to do things that are comfortable for me. When we hired a team of people with lived experience of homelessness, we put posters all over downtown. And that was the main way that people found out about us. That was during COVID. So we had a very different kind of process on things, but I was really surprised how important that piece was. I guarantee you, most folks who newly become homeless do not see those posters. There is no poster telling them, call this number, it's central, we'll get you processed through intake, we'll get you onto the registry list, and then we'll help guide you through the system. We need to build systems the way people use them. And I think to the violence against women example earlier, women use all of the services. They use the services that they need. They're making rational decisions for their context. And as a result, we need to design systems that respond to the fact that people are, going to use whatever makes sense for them. And the idea is that when you get to any of those doors, the first thing that the system is trying to do is to prevent your housing crisis. Okay, you're about to be evicted. What can we do to try and stop that? Do I need to talk to a landlord? Is there a fund that I can access to help pay rent arrears? Is it an issue with a pet? I don't know. There's all kinds of issues why people become evicted. But what can we do up front to stop that kind of housing loss? And that is the first step. And so it's not that shelter shouldn't be an option. That can always be a part of the options that people need. And that may be the right choice. But we need to focus that the response immediately is trying to stop a housing crisis, not directing people towards the shelter system as the way to get help. So I think in Ottawa, one of our challenges is because there's this emphasis on wanting to respond to people in the deepest need, which makes a ton of sense. But what it means is that you have to basically be in total crisis and in the shelter system in order to access resources. I think one of the most startling examples to me that I'd heard of this was doing some research with younger women who were in, transitional housing. And they said, with talking to our friends, the best way to get housing is if we become pregnant, right? So if you escalate your risk, that is how you actually get resources, which honestly is a very logical thing to do if a person's trying to survive. But we know what that leads to in terms of a whole other host of, implications for somebody as they're trying to move forward and thrive in their life. So that evictions prevention piece is sort of the first big thing we should focus on. School-based flags, kids, I think teachers are probably the first frontline workers. They know the kids that are at risk. They know the kids that are actually potentially in danger of losing their housing. And that's something that there's programs that can be developed for that. There's risk assessment tools. There are ways to understand who might be ready to fall into homelessness and how can we get ahead of that. And another big piece is no homelessness discharges, right? From hospitals, from jails, even from Children's Aid, we see that trend where people are at, a mental health care unit for 2 weeks or 3 months. They lose their housing because what ends up happening if you're on social assistance is that the shelter portion of social assistance ends up going to the hospital to pay for your hospital stay if you're there for a while. So then it's not given to your landlord, which means that you may lose your housing. I've had that happen to more than one people that I've worked with. It's illogical, right? You get discharged, you've just had your own mental health crisis, and you're being discharged into the shelter system. And again, I want to assert, every single agency and shelters are doing a lot more than just providing emergency beds. Everybody is a part of the solution. It's about how do we reorient the system so that people can play their role in a forward-focused system that's focused on trying to stop homelessness, that's supporting people while they're experiencing homelessness, and also housing stabilization. Let's put our supports in those places we know it's going to have the biggest impact. So to give you a sense, we currently have, you've probably heard of it, Housing First is like the big kind of, program. The concept is you need housing before you can do a lot of other things. It's pretty tough to find work. It's pretty tough to reconnect with family and friends and community. It's pretty tough to go to school when you don't have a stable, safe place to live. So that is a specific program, and we have 17 agencies that are participating in that, and then one kind of entry point for that program across a number of different agencies. The reality is we have way more agencies. We have about 143 just having the word homeless in their description. And then we have about 253 programs across all those agencies. So it's shifting to think of resources not on an agency by agency basis, but thinking of resources as collective. That's a lot of resources, actually. And we always need more resources. I'm never going to argue that. But we actually need to get a handle on what we do currently have and make sure that we're getting the right people to the right programs, and also the data to see, okay, this program actually is maybe needs more resources, and can we pull that from somewhere else that's maybe being duplicated, or can we just use our time better? A lot of people may have more than one worker, and every single worker is a generalist. Every single worker is doing housing. They're also doing support for mental health, and they're also doing substance use support. And if you have 3 workers all doing that, wouldn't it be better use of their time if one worker was doing housing, one was doing mental health support, and one was doing substance use support? So how can we use people's time better and also not burn out workers as much? So just to give you a visual, if you look at this image, there's 2 red houses and then a lot of other colors. So basically we're only coordinating the red houses. So we'll give you access, but just to these 2 houses, and we're not really looking at the broader picture of resources that we could be accessing. So how do we do the coordination? There's two kind of key pieces to this, and both are now mandated by the federal government. I had the privilege of being with Reaching Home, the National Homelessness Strategy, when they rolled in the new homelessness strategy. So these were the two big focus points. And when I say real-time data, what we're actually talking about are kind of two levels. There's individual person-specific data. I need to know John and the fact that John is specifically looking for housing, and he also needs to find, maybe he's looking for a work program. I need to understand that. I need to know when John came into the shelter system. And then I also need to see the big picture. How many people currently are experiencing homelessness? So that person-specific piece, we call it a by name list. And it's the idea that every person is not a number. They have a name, they have a history, they have a story, and that we shouldn't be asking them to repeat that story every time that they come into the system. And I remember sitting with, actually, it was a consultation with a number of agencies and workers. And one of the young people who was there who had lived experience said, you know what? Nobody wants to tell their story when they are in a crisis. And I think sometimes we think that storytelling is relationship building, and that's important, but we have to also step back and think about what would it be like if you were actually on the cusp of losing your home, or you just become homeless and you actually had to share that trauma with a stranger who cares and is kind, but is ultimately a stranger. So when we look at the by name list, it's this idea that we can see inflow, we can see who is coming into the system and also how many people. We can also see today who is actually experiencing homelessness. And we can also see on a day-by-day basis how many people are leaving. So that's your assessment of, are we reducing, are we increasing homelessness? Are we housing more people than are coming into the system? Or are we actually getting more people coming in than we are able to house? So homelessness is dynamic. It's changing constantly. Every single day is different. If we don't have this real-time data, it's really hard to get our handle around the actual picture of homelessness. So the system level piece, aggregate data, not a big surprise to anyone. But rather than every individual agency having their own numbers, and we can't tell how many of those numbers are duplicate, we have one system that's having everyone within that system is recorded, so we're not duplicating folks. And we have a common goal, and we have some numbers to actually drive towards that common goal. Reducing homelessness is the common goal, and the whole system is using the same numbers to be able to drive towards that goal. So Affordable Housing 101, I think you guys are already quite well versed in this, but I think there's some pieces and nuances that are really important to latch onto. And one thing that we are seeing at alarming rates right now is the loss of affordable housing. It's not even a matter of we can't build enough housing. It's the fact that we can't even keep up with the amount of housing that we are losing. So this is called specifically naturally occurring affordable housing. It is in the private market, but in Ottawa, we lose 7 of those private market cheap rentals for every 1 nonprofit housing unit that is built. We're not even treading water, we're just sinking. That's actually the state that we're in nationally. That number is 15 to 1. So it's really important to understand that scope in order to be able to start to get our hands around it. We had some recent really positive federal money through the Rapid Housing Initiative during COVID. The goal is to build 3,000 units across the country. Ottawa got $30 million. I think they're building about 200. No, they're building 109 units, which is great, supportive housing, we need it. At the same time, there was a rooming house complex that actually was about 200 and we lost it. So with that significant federal investment, the most that we have seen in years, probably in decades in Ottawa, we actually are at a net loss of 100 units. Like that's the level of crisis that we're speaking to. And those are things that every level of government has a part to play in improving that. But a lot of it's regulatory, right? And I think there's a piece here that we have to think about this from an equity lens. You know, it is state enabled and we have to remember that. And the reason I say that is we have way too many examples of racialized communities that are losing housing. And when you lose housing, you lose the thing that holds equity. And I mean that in the capital equity side. You lose the thing that holds value, and you also start to see generational wealth transfer and a huge gap between who has a home that they can sell and pass on to their children and who doesn't have a home. And if homes are the only way that we hold our retirement, that we hold our income and our estate, we are going to see massive gaps in people being able to overcome that poverty gap. I think specifically Ottawa, we see Africville in Nova Scotia, but the next, 4 are us. Little Burgundy was Montreal, Le Breton Flats in the 1950s, Herongate, which is active and coming to council on July 8th. So everybody do a deputation. The staff report on, over 200 folks who have been displaced, predominantly a racialized community, from cheap private market housing that they want to live in with their community. And then Manor Village was also a recent one. I think it's about 300 folks. Those last 3 in Ottawa are some of the largest mass evictions in North America, and they happened in our backyard. So we have to hold that, and we have to recognize who that's implicating as well. So here are some things that we can do as a city. And I think it's really important to put action toward the right level of government, because I think we want to ask the city for money all the time. They have no money. They just do not have the money for the most part to build capital money. In the federal budget or in the municipal budget, typically housing providers were asking for 15 million. The Alliance has pushed for that. Lots of other advocates have. 15 million might get you, I don't know, 80 units. Like, it's not actually going to make a dent in the numbers that we need. And that's not to say we don't need that 15 million, but more than capital, we actually need operating costs. Operating is from the province, and capital to actually get that building in the ground is federal. So when you look at city-led strategies, there's a lot of ability here to look at things that don't cost money, tons of money anyways, but that could be quite effective. One is stopping rent evictions. This is happening at a level that I get emails consistently almost every day of people reaching out and saying, my landlord has filed for an eviction. Basically, they're going to bulldoze my house and they're going to build a more expensive unit. And that is happening constantly. And COVID has escalated that at levels we haven't seen. We also have seen, the short-term rental market. So Airbnb, all of those kind of programs. And we have put in one bylaw, but we need to strengthen the enforcement on it. But it's this idea that there was about 5,000 units in Ottawa that went off of the longer term rental market, and that went into the short-term rental market. The sad part is it's a cycle, right? People buy a mortgage they can't afford, and the only way they can finance it is by having short-term rentals. So it's an ugly story on both sides, and both are victims of the fact that we have a housing crisis. And the third piece is tracking vulnerable properties. New York City actually has done this so that you have a triage of this property probably within the next 6 months is going to be bought out by a larger corporation and probably bulldozed and probably turned into more expensive luxury units. So how do we not only track them, but for cities to get ahead of that and have a right of first refusal? The other big thing is, public land, right? There are public land spots that are identified. There's zoning changes that need to be made, but there are strategies that we can do at a local level that would make significant difference to the lack of affordable housing. So I think this piece is really critical to what's happening now, and I don't have the time, but I think I have to stop talking soon. So real estate investment trusts are those companies that finance income generating rentals. I'm not going to dwell on that too much, but this is the story right now in terms of why our housing is escalating at such rapid rates. Large rental units that are cheaper are being torn down and replaced with more expensive luxury condos. I'm going to just breeze through these last pieces. I think the most important thing is that we have to tell a new story, and we have to think about the fact that, as long as we have a culture that says we can't do anything, this is an intractable problem, it's too hard, there's no money, la, 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 there's a million excuses. We have a million reasons for why this can't work. Well, let's look to what does work. And so I think the culture piece is the biggest component of actually seeing a shift in how we do this. And to be honest, I think that we as a community need to start getting some smaller wins. We need to start actually being able to see that this can work and pieces of this are successful. And that does happen in some ways, but I think we need some more of those as a community. So the news story that I would recommend telling, one, communities are actually ending homelessness. That's happening for real. Two, homelessness is a systems issue. It is not about individual failure. And as long as we focus on individual failure, we're not actually tackling the root of it. And ending homelessness is less expensive than maintaining it. Final piece I will leave with you is just that housing is the foundation that we need to thrive. You know, people can't do a whole lot else if you don't have a safe, stable place to live. And when I think about all of these other social issues, ending a homelessness, but specifically making sure everybody is only paying 30% of their income on housing, that does a whole lot for ending poverty. That does a whole lot for food insecurity. The long-term care crisis becomes a different story because we're providing enough nonprofit supportive housing. Healthcare is completely unsustainable. One of the biggest impacts we can do is actually provide safe, healthy, affordable housing to have people not go into the healthcare system in the same way. Talk to doctors, they say this all the time. Violence against women, exact same thing. If women had options, real options, there would be a lot more cases, I think, of not needing to have to stay as long, or at least a safe place to land when they're ready. Education gaps, and honestly, national debt. Homelessness is really expensive, and all of the fallout costs from homelessness, in some ways I feel, are doing significant things to our national debt. And it's something that we could do to actually start to decrease that and get things under control. So I'm going to stop. I think it's pretty much way past my time, so I apologize, but I will open it up for questions.
So I guess I will take over here just very briefly. Would anybody like to ask a question? I'll leave it
I
for.
put one question in the chat here. You had in the name list, you had move to inactive, and what does that mean?
So sometimes people, they don't get housed, but they basically leave the system. They don't want to come back. You sort of lose track of folks, right? Folks who are homeless, it's quite transient. So that's what it means. You just don't know where they may have gone.
So they could have actually found a family or somebody that they've moved in with.
Yeah, absolutely. Could be a good news story, might not be, but yeah.
Thank you.
Yeah.
Excellent talk.
Is there anybody else who's got a?
Yes, I put a question in the chat box too, but I'll say what my question is. Recently, I read that the Ottawa City Council has proposed, I'm not sure if it's passed yet, a high tax on houses that have been left vacant. I don't know what reasons they would be, but if they've been left vacant for a year, that the owners will be taxed a very high rate. Do you think this will have any impact at all on homelessness?
I think it will, in that it can slow the market down. I'm not totally sure that it leads to those units being affordable for folks, but what I do think it means is that you can't just own multiple homes to just grow wealth. And that's the big challenge that we're seeing right now, is real estate has basically become a lucrative investment, right? You put money in real estate, and this year your real estate went up 30%. 30%. Like, it is beyond, madness at this point. So I think in that sense, it will take some of the heat off the market. It has been successful in cities like Vancouver in trying to slow it down a little bit. Every tool matters, let's add them on. It's no silver bullet, but every tool helps.
Thank you.
I've got one quick question to ask, but I'll make mine the last question. Is there anybody else who has anything they'd like to ask right at this moment?
I don't have a question, but I have a comment. Katie, I really appreciate your talk. I work with Habitat for Humanity, so yeah, we're not serving the necessarily the same population as you, but we're all fighting to end homelessness in a different way. So thank you so much. Definitely appreciate the education.
Kudos on your work, because we need more family housing. Like, that is a huge, huge issue. It's the size of unit, right? There's very few large multi-room units. Cindy, did you have a question?
Yeah, I did. In your presentation, you had said that the women that are the numbers for violence against women are not included. And that just boggles my mind that they keep them separate. Why is that? Or will that ever come to be that everybody's included?
I think that it will change. The reason why right now is funding streams. So provincial funding is for violence against women shelters, and then federal funding flowed through the city is all the other shelter systems. So there's been a commitment by the city and the city staff in the 10-year plan to work on that gap in terms of the data. And there's certainly an appetite amongst VAW shelters to start to see that. And, you know, Cornerstone Housing for Women is like, women are everywhere. Like they're in both places, same with SHEPS, you know, so we can't act like they're only accessing one agency. So I think it will improve in the coming years. But it is something that is a concerning data gap. Absolutely.
Thank you.
Yeah.
Do note that we've reached our famous 6:45. I wanted to ask just one very quick question, and then CJ, it's back to you. There's a lot of stuff happening in the political arena as in terms of election cycles and things like that. And I've been following some stuff in the Canadian Alliance to End Homelessness on some of their stuff. Can you talk briefly a little bit about what's coming up in the voting cycle sphere, whatever?
Absolutely. So first of all, I'll ask all of you, if you're interested in this, to email the Alliance and say you want to volunteer. The Canadian Alliance, we are not formally connected, but I work all the time with Tim Richter, the CEO, and many, many staff there. They've launched a national nonpartisan campaign focused on vote housing is kind of what it's called. So they have 5 platform planks, and they're really wanting to focus on some targeted swing ridings. They're not really in Ottawa, but nonetheless, the goal is to make every election, but specifically this coming federal election, a housing election. Like you get in or you get out based on how far you're willing to take the affordable housing crisis and respond to it seriously. So they are working on that. Votehousing.ca. I really recommend going. They're asking for people to pledge. In Ottawa, we want to actually build off that campaign because we have a provincial election in June, and we have a municipal election in October 2022. So we have a lot of work ahead of us, but right now we're working with, I think at this point, it's like over 30 organizations to have an umbrella housing focused campaign so that the next 3 elections in this city are about affordable housing. You know what? I think council is there's a lot of change happening right now. And I also think the level of crisis has reached a tipping point and people are very, very worried about this issue. So it's an opportunity, as sad as that sounds, but please, if you want to volunteer, we at the Ottawa Alliance are going to try and develop a bit of a ground game on knocking on doors, pamphlets, communicating city hall or town halls. And we want to have the same group of folks and grow that group of advocates moving forward for the other 2 elections. But to start, go to votehousing.ca, sign the petition, see what you're comfortable pledging, but it's really important. It's the largest campaign of its kind that's ever been attempted. So I'm encouraged that I think we're starting to see some significant shifts.
Well,
Linda?
thank you very much. Thank you for that very, very interesting talk.
I have a question.
Certainly go ahead. We are a little bit over time, but go ahead, Linda.
I noticed that on the news last night that they were moving a camp from a park in Toronto, and many of the people did not want to move from their outdoor camp. They were leery of shelters. They were leery of going into whatever accommodation was going to be provided for them when they moved. So how do you sort of accommodate the requirement of the people who don't want to sort of move into a situation where they have to account for somebody else?
I mean, I think some city responses across the province, everyone's struggling with how to respond to encampments, but you start from a place of rights, right? And that the person living there is a rights bearer and there is a human right to housing. And housing is not a shelter. Housing is safe and stable and permanent. It's not a hotel. And I think the challenge is, you know, there may be a menu of options and some people may feel comfortable with a shelter. Some may want a hotel, but to provide real options for folks that they could actually have to go into housing, we're tapped for affordable units. I get that that's very difficult, but to start the conversation with the thought that people are rights bearers. And there's the other issue of criminalizing people who are marginal, right? Criminalizing marginal bodies, Black and brown bodies, predominantly Indigenous bodies, like having no public space for people who are vulnerable is another piece of this that has to be brought into the conversation in a serious way. We see that with architecture, with making sure that there's no way that you can sleep on a bench or that you can actually exist in public space if you are poverty insecure. So I think starting it from a right space is the most important piece, and fighting for real options. All right, I am going to go. Thank you so much all for your time. I really appreciate it.
One more thing, sorry, I just wanted to share. We always offer yellow roses as a sign of thank you. So thank you so much for being here with us and sharing the, an often unheard story, or at least side of the story. So thank you.
Thanks so much. That's lovely. I really appreciate that. Have a good one, everyone. Thanks.
Enjoyed having you, Katie. Thank you again.
Bye.
Bye-bye.